Well, what used to be taboo is getting more attention publicly. We're talking about menopause, but there is still a lot of confusion and frustration. Dr. Sonal Haerter with Dignity Health Medical Group is here with some advice. This topic, I feel like when women get together,
Yes.
this is one of the topics,
Yes,
right?
education is empowering. I think we need to
Yes.
talk about this so women know what to do when they get to that perimenopause and menopause phase.
Right, which nobody really prepares them for with the
Correct.
perimenopause. But let's break down again as a refresher. Menopause versus perimenopause. What's the difference?
So menopause is one single day after a woman has had no periods for 12 consecutive months. Perimenopause is a period before that, and that can actually be 4 to 10 years prior to menopause. Now, there's something called early menopause where women actually attain menopause under the age of 45, and premature is actually under the age of 40. So women need to know those numbers because menopause does have significant impact on heart health, bone health, and of course, different systems.
Yeah, okay, so let's break down the symptoms because they are long, but
Right.
we'll talk about the symptoms and then kind of, break out on some of the major ones and what we can do about it. But
Sure.
let's take a look here. I mean, obviously, we always hear about the hot flashes, the
Yes.
sleep. What else?
Hot flashes, sleep disturbance. About 40% women report sleep problems. And if they have hot flashes, sleep disturbance goes up to 90%. So very impactful. Memory loss, brain fog is something that I hear all the time.
Yes.
Hair, skin changes, joint pain, tendinitis. These are some common, actually, symptoms that are reported. 70% women also report fatigue.
Oh,
And
I can see that.
Yeah, an impact on relationships. There's sexual function, sexual health that also gets impacted pretty significantly. So pretty much all aspects of your quality of your life.
Well, and I feel like, let's just take, for instance, sleep. That has such a ripple effect. When you don't have sleep, of course you're
Absolutely.
going to have brain fog. Of course you're going to be fatigued.
Right.
I mean, it's almost like one causes another.
Yeah, and also anxiety and depression, mood changes. In this phase, perimenopause and menopause, 2.5 times more risk of experiencing anxiety and depression. So now if you add hot flashes, mood changes, sleep disturbance, that kind of explains a whole lot of not able to focus, not able to concentrate.
Okay, so let's talk about hot flashes. What can people do? Because that obviously is a big symptom.
Absolutely. 80% women report that. Only 30% seek attention for it. So menopause hormone therapy actually is very effective in the right patients. So this is not meant for all women, but hormonal therapy is great for hot flashes, followed by something called SSRIs or SNRIs. These are medications we traditionally use for anxiety and depression, but also are effective for hot flashes, also mood changes. There's one more non-hormonal medication called fezolinetant, also known as Veoza, which is great for hot flashes. And there's another medication called gabapentin. But along with that, lifestyle changes like maintaining healthy weight is going to reduce actually your incidence of hot flashes. Eating a healthy diet close to your Mediterranean style diet is effective for hot flashes. Physical activity is very important. Training, weight training is also very effective in maintaining your muscle and bone health.
Yeah.
And all these together can actually help with hot flashes.
How about sleep? That's another big problem.
Absolutely. And sleep is so critical. So number one, maintaining a routine. So wake up and sleep at the same time. Keeping your bedroom actually cooler is supposedly very helpful in hot flashes. So 67 to 70 degrees, what you can tolerate.
That is a little chilly.
It is a little chilly, but does help
Yeah.
with sleep hygiene. Having a routine like maybe a warm bath or saying a prayer, meditation, avoiding TV, your Instagram, or I'm
social
guilty of that a
media.
little bit,
Yeah.
phones, or going on your computers for paying bills, having conversations that can actually get you excited or anxious. So just having this ritual can actually help with sleep.
Yeah, I bet. All right. Great advice, Sonal. Thank you so very much. We appreciate it.